Welcome to Joy in Our Town. I'm your host, Vanessa. Thank you so much for tuning in and joining us for another great edition today. We always love joining you in your home, sharing some wonderful information with you, and bringing great guests to share their knowledge to better your life and bring some joy into your town. Today, we are very happy to be joined by a guest who's been here several times, and we hear you, our viewers, and we always get great phone calls, and so he is back again, Michael W. Smith, and he is a licensed counselor with House of Healing. Thank you so much for joining us today, Mike.
My privilege.
Wonderful to have you, as always. And today we're actually going to be speaking about an issue that we haven't spoken about with you before. So I'm very happy to learn this perspective from you on substance abuse. But before we get started, if you wouldn't mind sharing a little bit with our audience who hasn't seen you before about yourself and your history and what you do.
Yes, I'm a professional counselor. I've been in Maricopa County. This is my 35th year, starting my 35th year as a counselor here locally. And I got a wide range of counseling. Our practice includes family counseling, marriage counseling, individual counseling, chemical dependency, kind of a mixed bag.
So you've seen it all, you've heard it all,
Well, I don't think anybody's actually done that yet.
At all?
Boy, I've heard a lot more than most people. I've been doing this a long time, probably older than you are.
It's very possible. We won't talk about that on camera. No, you never ask a woman her age, Michael. You know that, especially on camera. I'm just teasing.
Assumed.
But that's wonderful to hear that you are working with people and helping people, and it's something that's safe to assume as people watch. I think a lot of people are afraid to say that they have an issue, or to say that they have a past, or to say that there is emotional problems in their life that have developed over many years. Is it safe to say that most people have experienced something in their life that is traumatizing and that could be dealt with?
Well over 90%, and particularly in this area, chemical dependency. The person is usually reluctant to admit it, but the family unit and the people that are living around them are obviously the first ones to notice it, and they're usually the ones that stimulate the person to get some help.
Okay, and so it's that's one thing I always love too whenever we speak about anything to do with substance abuse or mental or emotional issues is you're not alone. Lots of people experience these things, and so that's why we're here to bring you information so that if you're in a place, you have a family member or friend, please seek help and know that you're not alone, and there are people that want to help you and not judge you and help you bring the biggest, most fulfilling part to your life, which is joy and happiness and being free of any problems that may be there. So for all of you, yes, wonderful. And that's the show. No. So today we're speaking about substance abuse, and we have a professional here to share his opinions and advice for all of you. And the first topic is the importance of the mind in addiction treatment. This is something, as you mentioned, addiction. First of all, for people that are watching, what is addiction? Is it a mind issue? Is it a chemical issue? What is addiction?
Well, now that's a extremely difficult question to answer because the answer is so broad.
Yes.
But on the surface of it, it's always a combination of all of that. But the four things you need to consider if you have an addict in the family are the mind, the emotions, codependency, and spirituality. In 2007 and 2010, the American Psychological Association did a research study on spirituality in treating the mentally ill and the addicts. And they found that the control group, which got no spirituality included in the process, had poorer results than the group that had spirituality. So in my counseling practice, we do Christianity there, but the point of the survey was that if someone has a belief in God and a belief in principles from God, the prospects of the person improving or discontinue using the chemicals is much higher.
Okay.
And the reason for that basically is that the concept of God gives the person the idea that they're A, not alone, that B, somebody loves them and cares for them beyond themselves, and C, there's an accountability process spiritually. Christianity, Buddhism, Islam, whatever it is. We do Christianity at my counseling center. But there's an accountability process because in addiction, addicts are prolific liars. They lie to themselves, they lie to their family members, they lie to their employers. The whole system is based on multiple deceits, and lies. And so the group that had the spirituality had a moral compass, so to speak, over the group that didn't have it.
Okay.
And then the second thing you've got to consider when you're treating somebody who's an addict is codependency. In almost every case I've ever had, and I'm going to just be safe, 90% of them, to be safe. It could be 100. Somebody behind the addict is killing them while they're trying to help them. There's always a codependent personality behind the addict somehow, somewhere. It's usually a family member, spouse, relative, a very close friend. They mean well and they're trying their best, but they're actually helping to kill the patient.
And how so? And what aspects are they enabling this person in essence?
That's exactly what they're doing. They're enabling them in their addiction, but they're doing it out of concern and love. They provide things to the addict, shelter, food, money, different things that they shouldn't be. And if you have a hardcore addict, the important thing is for the patient to eventually reach a bottom. And so whenever you're treating the patient, you also have to find and hunt down the person behind them, the codependent, that's propping the thing up. Some people think they're helping, but they're actually not. So it's a family dynamic. It's never just one it's very rarely just one person. There's always a family dynamic behind the person.
It sounds like then there's a case where there needs to be tough love from a family member, a loved one, and not enable them. And that's probably one of the most difficult things. I've been friends of people that have been addicts and we've seen their families. And a lot of times, like you said, it's out of love. And they don't want to see that person hit that bottom point. But the few addicts I've seen come into recovery and leave that addictive lifestyle, there was that point where that person that was enabling them, as you say, had to step away and allow them to hit that bottom point.
Oh, no question. Then the next area that's most important is the processing of the mind. An addict thinks differently than a non-addict. And there's no formal literature on this, but so I just made up a name for it. It's called autonomic processing. I know this is going to sound a little strange, but if you think about it, it seems perfectly normal. The human mind, if it's used in a certain direction and for a certain purpose and in a certain thinking pattern, at some point in time, the mind clicks and runs on its own, out of the control of the person. And 100% of hardcore addicts I've ever worked with, every one of them have autonomic processing. For example, a pro athlete can train their body to react instinctively without thinking. They don't even think about it. Prize fighters, MMA fighters, football players, they move without thinking. But it took years to do that. Well, a human being can do the same thing, productively and negatively. You can, in a way, program your mind to run on its own without you having to do anything.
Create a reflex, in essence.
In the mind.
Yeah.
That's exactly right. And the addict, every one of them, has a mind that runs on its own, only the addict's runs negative.
Okay.
And that's why the relapse rate's so high. And that's why the recovery rate is so low, because the mind has not been reprogrammed. In church, you might call it renewing your mind. Mm-hmm. The person's mind has to be reprogrammed from the way it's been normally running, and it runs on its own. An addict thinks about getting high constantly, and it runs in their mind without them even noticing it.
Wow.
So in therapy and counseling, I have to catch those thoughts. You used a term off camera that was really great. They have mental triggers that they don't even notice, that they pick up in their environment. Somebody said something, they saw something, they had a smell that reminded them of something. Something triggered, and the mind starts running on its own.
Wow, okay.
And business professionals know that what I just said is true. They go the opposite. People like Tony Robbins run around the country making millions of dollars. What he's doing there is trying to reprogram the person's mind to think positively and not negatively, and charge you a large fee. But the process is the same. The addict's mind runs automatically negative, and a business professional or an athlete or something, their mind runs automatically productively.
So is that one of the reasons then that deceit is involved? Because they almost don't even, are they many times unaware that they're being deceitful?
Yes.
And that they're lying, that they've convinced themselves almost in this way, and their mind has become this process to where they truly don't think that they have a problem.
That's exactly right. Now, you said convince themselves. No, they don't convince themselves. What happens is, if your mind runs a certain pattern, if you have a certain thinking pattern, every human being's like this, and if it's repetitive, long-term, and aggressive, your mind will reach a certain point, and it's different for everybody, like fingerprints. It will click here and run automatically.
Okay.
And you'll meet this person, and you work with them, you go, I can't work with that person. They've got a one-track mind. Or, is that all you ever think about? You hear weird comments like that. What they're really saying is that person's mind, and some of your relatives and friends you can think of right now, have this autonomic processing. They've gone so long thinking a certain way, now it clicks on its own. So now the addict is lying or deceiving or dissimulating naturally, and it runs without them even knowing it's happening.
So that's why if you ask them, why are you lying? I'm not lying, I never lied. They don't even realize they've said something or done something because it's a reaction. So is it possible then to retrain our minds? They say, you hear things, it takes 30 days to start a new habit. It takes 30 days, repetitiveness. It's what you do over and over again that becomes you. Is it possible to retrain yourself? Is it possible for an addict to retrain themselves? Or do they have to become aware that it's actually there? Now,
those are two different questions.
Okay.
A non-addict or a patient that's not mentally ill can. An addict and a mentally ill person can't.
Okay.
They need help. And they have to get assistance from somewhere. Counseling, psychology, therapy, whatever source you can get it from. They have to be helped or retrained to reprogram how their mind thinks. And that's a painstaking process. It requires a lot of patience on my part. I have to sit down with the patient and go through the exact process their mind runs through and the thoughts of it. And the third area is usually this pattern of thinking, in almost every case, started in childhood or in young adulthood. So the addiction that you're facing now in your family member actually trails back to trauma, a wound, an injury, abuse, verbal abuse, mental abuse, sexual abuse. Something here triggered a wound in the heart that started this negative thinking pattern. And so 15, 10, 12, 20 years later, you're facing an addict.
So that's that wound that's created. It's an emotional wound, and that's actually perfect because that's what we're going to be speaking about in this next segment. But before we get into that, Michael, thank you as always for joining us for this first segment. It always goes so quickly with you, such wonderful information. For all of you at home, I hope this has been helpful for you. Please don't go anywhere. We're going to be right back after this short message.
Many medicines used to treat colds and flu contain acetaminophen, a pain reliever and fever reducer found in hundreds of over-the-counter and prescription medicines. But taking too much or more than one medication containing acetaminophen per day can damage your liver. So always read the label and don't take acetaminophen if you drink 3 or more alcoholic drinks every day. To learn more, visit fda.gov/OTC pain info. A message from the U.S. Department of Health and Human Services Food and Drug Administration.
Hello and welcome back to Joy in Our Town. I'm your host, Vanessa Rose. Thank you so much for staying with us. If you just happen to be joining us today, we are joined by Michael W. Smith, and he is a licensed counselor at House of Healing here in Arizona. Thanks so much for staying with us, Michael.
Our pleasure.
Pleasure to have you as always. Such wonderful information. The only problem with Michael is there's always so much information. It goes so quickly. We don't get to ask all the questions. So we just got done speaking about the mind and addiction. And Michael did a nice little segue into start speaking about the emotional side. So this second issue is, of course, substance abuse and the importance of the emotions in addiction treatment. You started to mention there how addiction is, of course, it's a mind thing, and it's something that is a repetitiveness. It becomes a process that a lot of addicts are unaware of. But you started to speak there about how many times that pattern stems from an emotional problem that started somewhere in their life, whether it be in adolescence, whether it be in their teen years, somewhere in their life, something happened that changed their process in their mind that led to this different click than other people.
In almost every case.
In almost every case. And of course, there's always going to be exceptions.
Yes.
But this is speaking in general terms about the majority of people, at least in your experiences that you've seen and studied and worked with. So how do emotions develop, and how does this play a role in addiction?
I'll give you the short version. When human beings are very young, usually 1, 2, 3, 4, children are learning sponges, and they don't have that skill later in life. That's something that they're born with, and they keep for a few years. But what children do at that young age, they all learn by imitation. So children imitate everything they hear and see, including feelings and emotions from their significant others. It's usually parents, step-parents, adoptive parents, but it could be other family members. That pattern of absorbing information, later on, if it's negative, comes back to haunt us. Here's why. Every time you have an emotion, underneath that emotion is a thought that triggers it. And the person may recognize the thought, or they may not recognize it. In an addict, that is crucial, because the thought is usually negative, self-abusing, fearful, low self-esteem. They develop defense mechanisms that are mental. And then the negative emotions cause the thoughts to become real. It's very similar to a patient that has a phobia. If I have a phobia or fear of the dark or spiders or heights, those are the most common ones, the phobia itself is based on emotions, and if they're fear-based illnesses, but the root of it is a thought that triggered it. So when I'm working with an addict, I have to isolate A, the thoughts, and B, the negative emotions that are being triggered by the specific thoughts.
Better than leading to the behavior of addiction.
100%. And since you mentioned that, the behavior of the addiction, food, drugs, sex, exercise, porn,
whatever
anything, that's never the problem. Now, it may be a family problem or a societal problem or a legal problem, true, but those are only symptoms. The real root of it is the negative emotions that are making the negative thoughts seem true to that person. So just like a phobia, that's a real fear to me, but it's not real to you. It's only real to me. And the reason the phobia is real is because of the negative thoughts that support the emotion. So you have to break that system down in order to help an addict understand how he's thinking and the negative emotions that are triggering the user.
Wow.
And now the #1 drug in the United States is prescription drugs. They've gone way past legal drugs now. Prescription drugs are huge. The behavior is never the issue. There's always a root to it. The behavior is only a symptom.
It's a dependency. Yeah, they're dependent because they're looking for, they're masking or covering, or it's a reaction to something. And so that being aware as a family member, then dealing with an addict, it's very difficult because they have to realize that that person is truly living in their own reality.
Yes.
And it's not necessarily out of selfishness. It's not even a choice. They're unaware. That they are living in their own reality, in their own world. Their present reality and what they think and see and feel and smell is triggering something entirely different than you could be sitting next to someone. And this is something that I think is very difficult in life, whether you're dealing with an addict or a different personality type or someone who comes from a different lifestyle than you.
Right.
you can experience the same exact thing sitting next to somebody, and they're experiencing something entirely different. And that's why whenever they say, you're living in your own world, that's usually a joke or a slight, but it's true. Each and every one of us truly, our experiences and our emotions that we develop through life, we are truly experiencing something in our own reality, in our own, what we're seeing that has been developed from emotions in life.
No question.
And so how does one deal with treatment of this, of emotions and learning how to get a hold of their emotions personally, and even more importantly, if there's a family member? Because a lot of times, have you noticed that it's not an addict that comes out and says, I have a problem, but it's their family members around them that says, we love you, and we see a pattern. And it's funny because it's almost what normally people would see as a pattern.
Yeah.
And so, like you said, it's the mind that consistently goes into this pattern. How does someone deal with that emotionally? A family member, a loved one that sees someone going through this, how do they deal with that emotional pattern?
Unfortunately, it's usually failure, because the things we've been discussing right now, most family members don't understand that process. The family members that love them just kind of say to them, why are you lying? Why do you use so much? Can't you quit? When are you going to stop? And then the addict then continues to fabricate and dissimulate and lie and push the person off and so on. But the emotions are the key to relapsing. Most addicts, the vast majority, relapse. And here's how it happens. The mind perceives fear or danger or disappointment or heartache or misery or sorrow. Once the person receives that thought as real, then the emotions of fear, loneliness, trauma, anxiety suddenly rise in the person, making the thought true. And if the trauma is significant enough in their mind, the addict relapses and they go back to using. And being an addict is so hard to treat. To give you an idea, AA and NA are very good programs for people, for alcoholics and drug addicts. They have about a 90-something% relapse rate. And that's why this thing is so hard to beat, is because the root of it hasn't been discovered at the treatment center or the detox hospital or wherever the patient went to. The root usually starts in childhood, and the addiction runs on how the person thinks and the emotions supporting the negative thoughts.
And so one thing that I know, there's great organizations like Al-Anon, and do you think that part of that also has to do with the family members around them and potentially reigniting that emotional trauma or that hurt, or by saying something and maybe not even meaning to do it in a negative way, almost pushing that addict back into that process?
In almost every case, your chances of not using again are extremely poor. But your chances are better depending upon the type of support system the person has. And when I have somebody in counseling, not only am I working on their mind and their emotions, I also work on the people who are codependents and the supporters in the family. Because the more supporters people have in the family, the greater their chance of recovery and not using again.
And whenever you say an addict, that's something that we've known family members and family friends who've been addicts. And once you realize that you are an addict, your whole life, you're always in remission, correct? Because you have that pattern or that whatever it comes from that is very easy to fall back into. So for the rest of your life, you have to deal with and be aware of that, correct? Or else you'll just go, not even in your own will, can just very easily slip back into that, like you were saying, that process that goes on in their mind. If you're not always aware of it and have people around you aware of it that can say, hey, I love you, but I just noticed you're doing that again or something. Is that something that is very important for them to do, and to be honest with themselves that once they realize that pattern is there, something they always have to be aware of?
You summed it up perfectly earlier. You used the term trigger. And in the counseling process, each person has different triggers. And the trigger is the negative thoughts in the mind, the negative emotions that make the thoughts real. And if the trigger is significant enough, that's what causes the relapse and the collapse.
So emotionally, just as a closing here then, Michael, how would you suggest, just briefly and very, of course, on the surface, every case is different, but if someone has a family member to emotionally approach someone in their life that they feel is an addict, how would you suggest they do so?
Well, now that's a tough question. The key to your emotions are the validity of them. And your emotions, generally speaking, are not your friend because they give off false signals. And so in the counseling process, what I have to do is isolate the thoughts in the mind and the emotions that are giving off false signals to the person. They have a fearful thought, they feel fear, and the fear is unwarranted or inappropriate or excessive or accelerated. And I have to help the person adjust that process by catching the thought and realizing that the emotion is not what they perceive it to be.
Wow. This is something that almost sounds like it could apply to everyone, even if they're not an addict. I mean, this is
It does.
something that
Everybody
truly
runs the
does.
same way.
Everyone runs on emotions, and we have irrational fears and thoughts, and we perceive things that are more threatening than they are. And just wonderful information. Thank you so much, Michael, as
Yeah, my
always, for
pleasure.
joining us and for sharing with our viewing audience this great information. As always, thank you for joining us here on Join Our Town. We love being with you every week in your home, and I hope that this has been helpful to you, and I hope that you realize that whether it's you or someone you love that is struggling with some sort of addiction, you're not alone, and people want to help you, and I hope that this has brought some joy into your life. We will see you here next week.
This program has been sponsored by the Trinity Broadcasting Network and is made possible by your telethon dollars. Your continual support can keep Joy in Our Town coming to your home every week. Write to Joy in Our Town, Post Office Box A, Santa Ana, California, 92711.